This video was sponsored by Back Specialist Hospital.
I'm Dr. Charles John Buckman, obstetrician gynecologist. Epidural is one of the pain management regimes in labor, right? There are other forms. So epidural is a medical way of managing pain. There could be non-medical ways of managing pain, where it could be psychological. You could give sometimes you can have somebody talking to you through the pain, like psychological support and all that. But the medical ones are mainly medications, like you can give some opioids, like pethidine. You can give the epidural. Epidural is actually an injection into the back, whereby they can introduce something called a catheter into the space that surrounds the spinal cord at the waist level. So, and then an anesthetic agent will be introduced in that space, and it sort of numbs the nerves that are coming out, like supplying the waist. So it blocks all pain sensation around the nerve area, the waist area. So when you're in labor, you won't feel any pain. The only problem with epidural is that it makes labor longer, because the pain sort of helps you to realize, let's say you are full, as in the cervix has fully dilated, and so you can push. But when it's taken off, you don't feel anything. So if we don't follow you up or examine you more frequently, we might not even know you are full, and that's ready to deliver. Sometimes to the second stage, which is the time when you're supposed to push till the baby fully comes out, can also be longer, because on the same thing, the pain sensation is taken off, so there's no urge to push. So then we have to tell you when to push. And the other thing too is we might have to give you many other medications to help get the uterus to contract, because the labor has taken so long. Sort of the uterine muscles are tired, so you need to give them medications to help the uterus to contract. The other thing is you may need to do some interventions to get the baby out in the second stage when the head is fully dilated, because of the lack of maternal effort to push. We may need to do some either forceps or vacuum, which is an assisted way of helping you deliver, because of the way the epidural has sort of disturbed the system. Yeah. There are some people who, let's say, has a problem at the back. If, let's say, you've had surgery at your back, or sometimes after an accident they may have to fix your backbones. Somebody like that cannot have an injection through the back, because you will not know where things would have changed. So then it will be difficult. So you may have other methods. Episiotomy is a way of allowing the baby to be able to be delivered without difficulty. Sometimes when at full dilatation, when the baby's head is coming out, like during labor, the muscles surrounding the vaginal orifice may be so tight, and so the head becomes trapped. So it's a bit difficult for the baby to come. So you can have an incision, which is to cut the vaginal opening a little bit to allow to give space for the baby to be delivered. This is much better than allowing the baby to force and get the head out, and with that it tears the perineum, and once it's torn in a ragged fashion, so suturing it becomes more painful. It can get infected, so it is not recommended. It's better to have a cut where it's like as in properly controlled cut, and then you suture it back. It heals better and with minimal pain and then less infections. So episiotomy is to prevent the baby delivering and having the vaginal walls being torn haphazardly. Previously, it used to be quite routine where almost every woman would have an episiotomy, but recently it is not. Research has shown that not every woman needs an episiotomy. Sometimes you may have a big baby So you can have a previous baby with no episiotomy, but the next baby becomes a bit bigger and so more difficult to push out, and so you need to create access for the baby to come out. So that's one of the reasons why some women may need episiotomy, but it's not every person who needs an episiotomy.
This video was brought to you by Back Specialist Hospital and Fertility Center.